Good afternoon, Bahamas. The Ministry of Health welcomes you, the public, the media, and others to our latest COVID-19 update. Joining the Minister and I today are Dr. DeLon Brennan, Dr. Nakia Forbes, Dr. Indira Martin, Dr. Jillian Bartlett, Dr. Frank Bartlett, Ms. Mary Walker, and Dr. Gina Archer. Today, we begin as usual with Minister Wells. Minister?
Good afternoon, Bahamas. Here's the latest national COVID-19 report. On Wednesday, the 17th of February, 2021, there were 10 newly confirmed cases of COVID-19. This brought the total number of confirmed cases in the Bahamas to 8,403. Currently, there are 2 moderately ill COVID-19 patients hospitalized in the Grand Bahama healthcare system, and there are no patients currently in intensive care. Notably, these numbers remain steady for the month of February, but we are monitoring these numbers carefully for any possible signs of outbreaks. In New Providence, there are 9 hospitalized COVID-19 patients at Doctors Hospital. 6 are moderately ill, and 3 currently in intensive care. There are 2 moderately ill COVID-19 patients being treated at the South Beach Acute Care and Referral Center. However, there are no patients with COVID-19 at the Sandilands Rehabilitation Center. At the Princess Margaret Hospital, there are 5 moderately ill patients with COVID-19. No patients are in ICU at PMH at this time. In all, there are 1,023 active cases of COVID-19, and 29 persons have been recently classified as recovered from COVID-19. This brings the total number of recoveries to 7,148 for a recovery rate of 85%. Fortunately, there were no deaths confirmed yesterday. The total number of confirmed COVID-19 deaths now stands at 179. 15 deaths remain under investigation. Ladies and gentlemen, one COVID-19 death to us in the Ministry of Health is one too many. We continue to pray for the families in the Bahamas who have lost loved ones to this awful pandemic. Ladies and gentlemen, a total of 65,392 RT-PCR tests have been carried out for COVID-19 in country. 236 tests were performed yesterday, with 10 positives and 220 negatives. 5 tests were repeated to determine recoveries, and 1 test was inconclusive. Again, we thank our nurses, doctors, emergency medical services, other healthcare, and essential workers for their continued dedication and devotion to caring for COVID-19 patients. We also extend our gratitude to your families who have also made the necessary sacrifice to support you in your position to graciously help others in our country. Ladies and gentlemen, it was on the 30th of January 2020 when the Ministry of Health held the first press conference about the novel coronavirus that is now referred to as COVID-19. At that time, we briefed the country on our preparations to deal with the virus should it reach our shores. Later, we experienced our first case of COVID-19 on the 15th of March, 2020. Would you believe it? It has been 1 year reporting via press conferences on this virus. 1 full year. My brothers and sisters, have you and your family fared with this new normal? Are you tired of wearing a mask? Are you wary of physical distancing? Do you miss getting together with friends and family and to feel their warmth and the warmth of our greater community? You are not alone. This global pandemic has lasted much longer than we all anticipated. There is a great temptation to let our guard down and ease up on taking the necessary health precautions. Globally, there are currently about 110 million cases of COVID-19, and there have been about 2.5 million deaths. Notably, 8,393 of these cases and 179 deaths are found in the Bahamas alone. Since the 1st of January 2021, although our daily numbers are relatively small, we have seen some 504 confirmed COVID-19 cases and 8 deaths. With these numbers in mind, more than ever, now is not the time to let our guard down. We must remain vigilant and avoid a possible calamity, a possible third wave. It is important to continually protect yourself and others. It is easy for us to reason. My family and I will not catch COVID-19. Perhaps it may be because we do not know anyone who've caught COVID-19, or perhaps the person we know who contracted COVID-19 was asymptomatic and did not get sick or was hospitalized. We might also be reasoning that I only socialize with family members, and I know they do not have COVID-19. My fellow Bahamians, we cannot be overconfident and think that catching COVID-19 cannot happen to us. To help you and your family remain safe, remember these 3 facts. Life is sacred, and we must all place a high value on life to protect all Bahamians. Secondly, we should always listen to the health authorities and the authorities in general. They have the responsibility to protect us. And third, do not develop a casual attitude. This can cost us our lives and those of our family members. It is noteworthy to mention that at a town hall meeting this Tuesday past, the President of the United States announced that his country hopes to come out of the global pandemic by the end of the year, December 2021. At this time, the government of the Bahamas, we cannot forecast when we will return to pre-COVID-19 conditions. We await the arrival of the vaccine to help us cope with the effects of this virus. In connection with this, the Prime Minister will address the nation on Sunday to provide a full update on the COVID-19 vaccine. Moreover, as we continue to face the new normal, we must aim to remain healthy together. Why is it so important to remain healthy together? Well, many normal activities such as outdoor dining, fellowshipping at church, and traveling have continued since July 2020. Recently, many persons, including civil servants who were working remotely or on a shift system, have been called back to work as of the 1st of February 2021. Whilst government schools are currently on the virtual platform, it has been announced that they will commence hybrid face-to-face learning effective this coming Monday, the 22nd of February 2021. In fact, many private schools have already returned to classrooms to resume face-to-face and hybrid learning, and schools in Grand Bahama have been engaged in face-to-face learning since October of last year. With more of us in the same spaces, we must continually exercise physical distancing to remain healthy together. In this regard, the Ministry of Health is pleased to announce the launch of the Healthy Together campaign. This initiative provides members of the public with a source of information and resources about COVID-19 and how to promote and maintain health and wellness. Healthy Together is designed to be accessible, shareable by all Bahamians. Since our children will soon be returning to school, we must focus on keeping them safe. Let us see how we can do just that.
Our kids will soon be returning to school. Let's keep them safe by following these 4 easy steps. Students and staff should stay home if they are sick. This keeps the school community safe. Wear a mask to protect yourself and others. Don't forget to label them and pack extras. Stay 3 to 6 feet away from others whenever possible. Wash your hands often for at least 30 seconds using soap and water. For a quick clean, use an alcohol-based sanitizer. Let's keep COVID-19 out of our schools and stay healthy together.
Staying COVID-19 free at the office is an essential part of slowing the spread of the coronavirus. Please turn your attention to the message by which this can be safely accomplished.
Staying COVID-19 free at the office is an essential part of slowing the spread of the coronavirus. It is always safer to work remotely, but if you must go to the office, practice the following tips to stay COVID-19 free. Stay 6 feet away from coworkers at all times. Use video calls, emails, and phone calls instead of in-person meetings. Eat at your desk instead of the cafeteria. If you are experiencing cold or flu-like symptoms, you should stay at home. Let's stay healthy together.
My fellow Bahamians and residents, the Healthy Together campaign will take an evidence-based approach. It aims to promote responsible behavior and encourage a mindset change that is compliant with public health measures to protect our entire population. Over the next 2 months, the Healthy Together campaign will have a multi-channeled and multimedia rollout. It features various graphic and video-based social media posts, television advertisements, and articles. It also showcased an official website at healthytogether.gov.bs that will serve as a central hub for all health information. Topics covered by the campaign include general safety tips such as proper hand hygiene, cough and sneeze etiquette, cleaning and disinfecting responsibly. These recommendations should be followed daily, whether or not there is a pandemic. But there is a pandemic. Also included is information about mask wearing and physical distancing best practices, as well as population-specific advice for those with underlying health conditions. Non-communicable diseases are prevalent in our society and have given rise to specific comorbidities in our population. Healthy Together will address many of these healthcare issues. In addition to learning the symptoms of those suspected to be infected with COVID-19, attention will be given to our precious pearls, the elderly in our society. Guidelines will also be given for public interactions, such as fellowship shopping, shopping and traveling. A topic that will have received increased attention is that of mental health. Here is a preview of what to expect.
We are all in this together. That means your family members and friends are experiencing the same boredom and emotional strain as you. Get online, interact, and connect with them. keeping your distance doesn't have to limit your reach. Expand your community, network, and meet new people through social media. There are so many new opportunities just waiting to be discovered. Remember, staying connected and building community is vital for your mental health. Let's all stay healthy together.
Ladies and gentlemen, many persons are feeling pandemic fatigue after sustaining major lifestyle changes for so many months. The Healthy Together campaign serves as a vital reminder for members of the public not to let their guard down. The requirements of the new normal, although simple, can be burdensome. Again, now is not the time to feel perturbed by the requirements of the new normal. We must remain disciplined and not let our guards down. Thanks to the governmental leadership acting on the advice of our healthcare professionals, and thanks to you and your efforts, the extremely devastating impact that this virus could have had on the Bahamas has not been fully materialized. Moreover, our success as a nation depends on continued collective adherence to the public health protocols. As the country prepares to resume more services, let us keep focused on the goal of limiting the spread of COVID-19. Let's take a minute to remind ourselves how this virus spreads and why it is important to continue to apply the health precautions. Your mask protects me, and my mask protects you. Let's keep it on.
Every time a COVID-19 infected person coughs, sneezes, or even breathes, they're releasing respiratory droplets into the air. As few as 1,000 viral particles entering the system can lead to infection.
To put this into perspective, it takes a COVID-19 infected person 5 minutes to release 1,000 viral particles while talking, and a single cough or sneeze can release up to 2 million viral particles. These particles may remain in the air for hours in a poorly ventilated area. Here's an equation to help you remember how COVID-19 spreads. Infection equals exposure to viral particles plus time. This means that the more time you spend in high-risk areas, the more likely you are to become infected. To reduce your risk of infection, continue to wear your masks, avoid crowds, practice social distancing, and stay home when possible. Let's try our best to stay healthy together.
So remember, my brothers and sisters, to wash your hands, maintain a distance of 6 feet from other inside or outside the workspace. Communicate by telephone, emails, or virtual calls to keep the organization connected and safe in a shared work environment. And have your hand sanitizer with you at all times, even when coming out of the grocery store or going to church. Wipe down and sanitize your work areas frequently to maintain a COVID-19 free environment. Stay
Riding the
home
bus.
if you're sick, and if you get sick at work or school, isolate yourself
Riding the bus.
immediately and contact your healthcare provider. After months of virtual learning, the excitement to see friends, teachers, and administrators face-to-face will be inevitable. In the excitement, do not forget to apply the safety protocols. Instead of a hug or high five, bump elbows. Instead of sitting close to others at lunch, sit arm's length apart. You will still be close, but safe. And remembering, sharing is not encouraged during this time. However, if it cannot be avoided, share safely by cleaning and sanitizing objects properly. On monitoring the behavior of several residents, it is noted that many have congregated outside bars, restaurants, and other social activities, and have pulled down their masks while socializing. Please be reminded that the COVID-19 is transmitted via respiratory droplets. If you are congregating anywhere and persons are talking, laughing, and smoking without a mask, you can still breathe in the respiratory droplets of someone in the group who has COVID-19. Whilst being outside, increase the flow of air. It does not reduce the risk of exposure if people are not wearing a mask. My fellow Bahamians, please, 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 wear your masks at all times. The Healthy Together campaign promotes the health of Bahamians as we keep our economy open. It is just one aspect of an integrated effort for the Bahamas to be victorious in the battle against COVID-19. No one is exempt from the effects of COVID-19. If we all work willingly in solidarity, we can reduce the spread of the virus transmission throughout our islands. Today, we also launched the Healthy Together Bahamas website, which can be found again at healthytogether.gov.bs. Healthy Together is a government initiative to consolidate and coordinate government information resources and communications related to COVID-19 as we move into reopening responsibly. On this website, you can find information about how the government is combating COVID-19. There's information about travel and border control. At the Community Health and Wellbeing tab, visitors to the site can explore the factors that put people at risk for COVID-19, how to assess health, promote mental well-being, and prevent family and sexual violence. A tab has been also provided for resources and updates. Very soon, another tab will be added that stores all the information about the COVID-19 vaccine in the Bahamas. As we move along, there are plans to have many, many more additions to the website in the coming days. The website provides relevant contact information and links to other government agencies. Through this campaign, it is anticipated that all Bahamian citizens, residents, and our visitors will engage in the measures that have been recommended for preventing COVID-19. The campaign will provide the information, and the society will put the recommendations into actions. When safety measures are practiced at home, in the workplace, at gatherings, or in the public domain, the risk of transmitting or contracting COVID-19 and other viruses, such as the flu, lessens with each measure used. Ladies and gentlemen, within this global pandemic, there is an infodemic. According to the World Health Organization, an infodemic is an overabundance of information, some accurate and some inaccurate. That is what makes it so hard for people to find trustworthy sources and reliable guidance when they need it. With all the advancement that technology has brought, along with the accurate information intending for knowledge and guidance, misinformation or inaccurate information is also circulated, regardless of intent. Misinformation and disinformation intended to deceive can negatively affect human behavior, mental health, and pose a risk to public health and well-being. When you receive health and vaccine information, whether by email, social media, word of mouth, I encourage you to check the facts for yourself using reputable sources such as the Ministry of Health and the Office of the Prime Minister's website and the World Health Organization's website. We all have a responsibility to seek and share the facts so that informed decisions and the right individual choices can be made. During this pandemic, and long after, the Ministry of Health will continue with its long-established practice of providing the public with science-based information. My brothers and sisters, we all want this pandemic to be behind us. As we move to the end, I encourage you to be disciplined, to be vigilant, take personal responsibility, to apply the health precautions at all times. Let us all remain healthy together. May the Lord of life, our God, bless you and your family, and may God Almighty bless this great Commonwealth of the Bahamas. CMO.
Good afternoon again, Bahamas. Slide. Thank you. From the national perspective, this graph is encouraging. It shows that our strategies and collective actions have and continue to reap benefits. As you can see, the height of the blue bars are trending in the right direction, downward. And the orange line is flattening. Next slide. This series of graphs demonstrate that each of our islands are contributing to the overall flattening seen in the previous graph. Next. We are an archipelago with many islands and keys. This graph highlights that the COVID-19 realities on each island will likely differ at times, as demonstrated by Andros in this graph, which has been showing an increase in cumulative cases as evidenced by the orange line uptick starting late in January. We are monitoring this situation closely. The second wave of the COVID-19 pandemic in the Bahamas has been protracted, now at 231 days and counting. Our collective diligence and consistency in adhering to both public health measures and the emergency orders have been key to our country's incremental or phased reopening of the economy, and it will aid us in getting to the other side of this COVID-19 pandemic. Islands constituting the Micyle group continue to have extended periods without new cases, as you can see on the graph. Over the past 3 months, the maximum number of days without new cases for Abaco has been 14, Andros 19 days, and Eleuthera 12 days. This streak, however, has been interrupted. And since mid-December 2020, these islands report new cases on an intermittent basis. Grand Bahama and New Providence continue to add new cases almost daily. Looking a bit closer at the trends in incident or new cases, New Providence still contributes the greatest proportion to our overall COVID-19 burden. Specifically, over the past 28 days, the Bahamas has recorded 295 new cases. Of these, 222, or 75%, were localized to New Providence. Weekly averages for New Providence have been in the single digits since mid-November 2020. In the week starting the 7th of February 2021, this average spilled into the double digits at 11.3. This represents a 53% increase over the prior week, and a 39% increase over the mid-November mark. The ministry is paying close attention to any indicator that demonstrates a sudden upward shift. Grand Bahama's current weekly average of new cases is 1.6, demonstrating no significant increase over the prior week. For all Bahamas, the average weekly new cases is 14. This graph presents weekly COVID-19 incident cases, the trend data, but it's just in a different way. It reflects the moving average, which is used by the CDC to determine our travel destination advisory status. Of note, New Providence 7-day moving average, represented by the orange dotted line, shows a modest incline or upward trend, while the Family Island groupings and Grand Bahama reflect a decline, represented by the blue dotted line and the gray dotted line. We must continue to be vigilant. The Ministry of Health, through its contact tracing officers, has identified 4 distinct clusters of COVID-19 cases, which have emerged within the last 10 to 14 days. The cases associated with these clusters account for nearly 30% of all new cases, i.e., that is 162 reported during the last 2 weeks. The schematic that you are looking at illustrates the clusters, which are linked to the islands of New Providence and Grand Bahama. Cluster A produced 26 COVID-19 cases. Cluster B, 6 cases, 5 of whom required hospitalizations, and 7 contacts have been confirmed to date. Cluster C produced 7 cases, 2 of whom required hospitalization, and 9 contacts so far are associated with this cluster. Cluster D produced 8 cases, 1 requiring hospitalization. 60 contacts are associated with this cluster. There is a clear link between Cluster A and Cluster B. If you look back at the graph, you would see the dotted line that connects Cluster A and Cluster B. Investigations are still underway to determine if there are further linkages between any of the other clusters. The linkages underscore that our daily activities are not in isolation of each other. We move from home to work to social settings. Each point along our movements creates the potential of becoming infected or infecting others with the virus that causes COVID-19. Virus spreading equates to economy slowing. And this we can ill afford. The appeal to not gather in groups larger than 20 and to limit movements as much as possible remains relevant. Hospitalizations were noted with each cluster. This is of interest not just in terms of absolute numbers, but also in terms of level of severity at presentation with hypoxia or low oxygen and severe respiratory symptoms. These hospitalizations likely contributed to the uptick in hospitalizations, which we see represented as a sharp increase on the tail of the blue line in this graph. I'll say that again. The hospitalizations associated with the clusters that we just spoke about likely contributed to the uptick that you see in the blue line on this graph, which represents cases hospitalized. As hospitalizations increase, there is greater strain on our healthcare system. COVID-19 hospitalizations and the percentage of ICU beds occupied by COVID-19 patients have been indicators that the Ministry of Health has tracked since the start of the pandemic. In mid-November 2020, there was a notable point on the timeline in the second wave. At this time, COVID-19 hospitalizations had been successfully reduced from triple digits and high double digits to less than 25. Hospitalizations have not risen to that level again until now. Total COVID-19 hospitalizations on Saturday past climbed to 24, which was a break from the low double digits that we experienced during the previous weeks. The minister would have given you the numbers of hospitalized and the categories that they are in when he spoke. Although our data confirms we are still flattening the curve and remain in the blue area on this graph, the hospitalization trends over the past 7 days warrant close monitoring and an reinvigorated solidarity by all Bahamians to put COVID-19 at bay. Next slide. A topic of concern currently is the SARS-CoV-2 variants. The novel coronavirus, like all other viruses, is susceptible to mutation as it replicates, evolves, and spreads. Only mutations that provide an advantage to the virus in transmissibility, replication frequency, viral load, or protection from immunity in the host thrive well in the population. Presently, the detection of variants may be skewed toward high-income countries because of the lack of equipment, resources, or capacity to perform genomic sequencing in others. Many variants have emerged of this virus since the pandemic began. Some sources state at least 4,000, with 3 variants proving to be of great global concern, as they have transmissibility, virulence, or fatality rates that are higher than the original virus. These include, as on the screen, the United Kingdom variant, the South African variant, and the Brazilian variant. As multiple variants circulate, sometimes recommendations are shift. As the National Health Authority, one of the ministry's role is to inform and share credible developments occurring in the COVID-19 space. This includes information on the life-saving COVID vaccines, but also other aspects. We are aware of the recent CDC, or Center for Disease Control study, which concludes that double masking, or wearing 2 masks, or knotting and tucking the air loops of a single surgical mask, which will help with the fit, can reduce the exposure of viral particles between source and receiver, upwards of 95%. This study suggests that this approach provides better coverage than a single mask. be it a surgical mask or a single cloth mask. The benefits from mask wearing will only occur if we wear our masks properly. We must ensure that the nose and the mouth is covered. Until vaccine-induced population immunity is achieved, universal masking is a healthy, effective means to slow the spread of the SARS-CoV-2 virus. When combined with other protective measures such as physical distancing, avoiding crowds, avoiding poorly ventilated indoor spaces, and proper hand hygiene. We continue to underscore that the country is not COVID-free, and we must all consistently wear a mask, wash our hands, respect social distancing, and follow emergency orders. These can be found on the Office of the Prime Minister's Facebook account or at opm.gov.bs. The ministry reminds of 3 sections in the orders. Indoor dining at restaurants is still not allowed. The curfew in Grand Bahama extends from 11 p.m. now to 5 a.m. daily. All operators of crafts, passengers, ferries, mailboats who offer inter-island travel services must ensure each passenger presents a valid Bahamas Health visa at the time of boarding the vessel. Social gatherings are still limited to no more than 20 people. The pandemic is not over. We cannot stress enough that the pandemic is not over. Yes, we have had success with containment and mitigation measures in both the first and second waves. And yes, our public health measures have proven sound. And yes, vaccines are on the way, but we are not out of the woods as yet. Stopping this pandemic requires using all the tools we have available. The public health measures we mentioned previously, as well as incorporating other measures. We understand that some people may be concerned about getting vaccinated. Now that COVID-19 vaccines are available. Having the COVID-19 vaccine in country is of no use unless each of us gets vaccinated. Here are some of the reasons to get the COVID-19 vaccine, as supported by research. COVID-19 vaccines will work with your immune system, so it will be ready to fight the virus if you are exposed. The vaccine is effective at preventing disease and serious illness. Getting vaccinated yourself may also protect people around you, particularly those at increased risk for severe disease. Among these are the elderly and those with underlying medical conditions. From national health statistics, we know that 48.3% of Bahamians have been diagnosed with hypertension or diabetes. This percentage mushrooms when other pre-existing conditions, such as cancer, chronic kidney disease, and smoking, to name a few, are factored in. A fourth reason for us to get the vaccine is the vaccine gets us closer to a post-COVID era and quickens the revitalization of our economy, resumption of cultural and social norms, and physically connecting with those we love. As current evidence suggests that reinfection with the virus that caused COVID-19 is uncommon in the 90 days of, Current evidence suggests that reinfection with the virus that causes COVID-19 is uncommon in the 90 days after initial infection. However, experts don't know for sure how long this protection lasts, and the risk of severe illness and death from COVID-19 far outweighs any benefits of national immunity. If you have had COVID-19 already, the science supports still being vaccinated. Finally, the Bahamas hopes to benefit from the 1,000 doses of the AstraZeneca vaccine that will be procured through the COVAX facility. As my minister would have mentioned, the Most Honorable Prime Minister will provide details of any advancements on this front. We strongly encourage you to make the decision to have the COVID-19 vaccine for your protection, the people you love, and for the prosperity of our nation. Thank you for your attention, and the floor is now open for questions. Matthew Morley, Eyewitness News.
Yes, good afternoon, Matthew Moxie. So we understand that Bahamas Air has been fined a few times for allowing passengers on their flight without travel health visas. Can health officials explain why this has been happening and how they are ensuring that this isn't happening with other airlines, especially international carriers?
So, as it relates to Bahamas Air being fined for allowing persons on, we have a system in place. We work closely with our tourism partners to determine what is happening in the environment as it relates to aviation and airlifts. Inter-island travel domestic travel has proven a challenge as it relates to persons actually having the visa and presenting it, having the necessary documents to present. We are working closely with the civil aviation grouping to ensure that we provide, I would say, sensitization sessions as well as support. As it relates to the international flights, I would ask Dr. Brennan, who is our tourism liaison, to speak to that.
Hi. Mr. Moxley, I heard the response by the CMO, but what was the original question as it relates to international flights?
It's just the question was, how are we ensuring that what's been happening with Bahamas Air is not happening with international airlines? As we know, there are new strains out there, and we're trying to protect our borders.
Okay, thanks. So I think as most of us are aware, the requirements for persons to come into country are very stringent and are monitored from before persons are even able to get on a plane. And so those requirements of having to have a real-time PCR test at least 5 days before they come into country is a mandate, and that goes through the first check of just persons submitting it through the Bahamas Health Travel Visa System, and then it is checked by the individuals through the Travel Compliance Unit in collaboration with the Ministry of Health. Then they are able to apply and be granted. In that instance, we then monitor to ensure that everyone who actually gets on a plane, there's international regulations that are set so that the persons on the front end in the international destination actually check to make sure that they have the health visa, and many of them will also ensure that they have their test available as well. When persons enter into country, both the possession of a health visa and most times possession of the test is actually checked by immigration officials when they arrive. And if those individuals don't have the appropriate documentation, they are then referred to the COVID enforcement unit. So there are multiple levels of protection to ensure that persons are not entering into the country without the appropriate documentation. Thanks.
Mr. Moxie, my apologies for calling your name wrong initially. Do you have a second question?
Yes, no problem. I noticed your presentation on that very big cluster of cases, and I know recently we had at least as much as 20-something cases one day. Are health officials able to provide a bit more information of where those cases originated from, if it was from a workplace or a gathering, just providing some clarity on that?
Okay, so we can say to you, workplace, I know one of the largest cluster was workplace related. The smaller clusters, I think, is a mix of workplace and gatherings. Jemanita Swain.
Good afternoon, CMO. Good afternoon, Bahamas. CMO, can you give us an idea of whether or not there have been any reinfections as it relates to COVID-19 in country?
Okay, we would have had reports of reinfections. Well, persons who would have been infected previously being infected again. I have Dr. Martin from the reference lab. I'm not sure if she's in a position to speak to what she is seeing in the lab setting, but we did have one or two situations where persons who would have been previously infected would have actually passed the period and would have been reinfected. Dr. Martin, are you able to speak to what you're seeing at the lab?
Sure. Good evening, good afternoon. So the thing about reinfection is that one of the criteria that we use to say that it is specifically a reinfection is that we have to perform genomic sequencing on that sample. And as you would be aware, we do not have that capacity in country. That being said, what we have done is set up a proactive approach to studying reinfections going forward so that those samples will be retained by the lab. It may not be our lab, but whichever lab would have recorded the reinfection. We're asking them to retain that sample, and we would then include it in our genomic surveillance. Thank you. In order to say, sorry, that this is a true reinfection.
Dr. Forbes is also on. I'm not sure if she wished to speak to what she's seen in the clinical environment.
Good afternoon. So that is correct. To say without a shadow of a doubt that a patient is reinfected with COVID-19 requires genomic sequencing. And the reason for that is because there are many other respiratory viruses that can present with similar features of COVID-19. And so there's actually a set criteria for how one would determine the patient has been reinfected. There has to be a certain period of time, at least 3 months that has passed by, and the strain has to be different. So we cannot confirm that at this time.
Thank you, Dr. Forbes. Jemanita, do you have a second question?
Yes, thank you so much for answering, Dr. Martin and Dr. Forbes. For CMO, my second question, in your presentation, I know that you touched on the number of COVID variants out there, the UK strain, Brazilian, and I think you mentioned the South African strain, but I think at least 7 variants are in the United States. We get a number of tourists or visitors from there. Are you concerned about any of those variants making their way here through those, I guess, imports?
There is concern that variants will cross borders. And certainly we have not shut our borders. We've not closed our borders. We continue to receive visitors to our borders. So there is concern that we can have the introduction of you know, at least one or more of the variants. This is one of the reasons why we have to remain vigilant as it relates to the measures that prevent spread. The measures that prevent spread of the original SARS-CoV-2 virus. The public health measures, those they still work. And yes, I alluded to in my presentation that you know, increased transmissibility, increased virulence, all of those things may be associated with a particular variant. But we, as Dr. Martin said a few moments ago, we have put in place a guideline as it relates to being in a position to select samples in order to get the genomic sequencing done. That will have to be done out of country, but we are doing monitoring to seek to determine whether or not, you know, what variants are actually circulating here. Retrospectively, we sent off samples. We're still awaiting those results, and we will be prospectively sending samples off to various labs in order for us to be able to determine what we have here. But the best protection for us is to continue to adhere to the public health measures, and certainly as we move in the direction of having the vaccination in country, that will also boost our immunity and protection against the virus. Jasmine Brown.
Good afternoon. Going back to the clusters, the 4 clusters in the past 10 to 14 days, I know Matthew asked about cluster A and the 26 cases. Now, there have been reports circulating. I know you mentioned cluster A was a workplace. Reports circulating that there were infections at a local hotel. Are you able to confirm if that resort was the Atlantis?
The Ministry of Health, we value our interactions with the public, workplaces, and other settings. We generally do not provide that level of detailed information. We provide to you what we are best able to provide, which is that we are having clusters. Those clusters are being linked to each other, and we have to do what is required from a contact tracing perspective, as well as from a, you know, increasing our public messaging to ensure that we, as best as we can, get the community to realize that we are not out of the COVID-19, I would say, the pandemic. We have done well, but long and short, we will not identify any particular venue where we're having cases. Do you have another question?
Yes. I noticed that the 15 deaths under investigation have been on the dashboard for quite a few weeks. When will they ever be determined if they're COVID related or not? And have death certificates been issued for these cases? And even have these persons even been buried as yet?
Okay, to the point of being buried, I will allow Ms. Walker from the PMH to speak to that. However, what I would say to you regarding the 15 cases that remain, you know, will remain for classification. We have a group that actually carries out the review of each of those deaths. That includes the pathologists, it includes clinicians, it includes public health persons that review the necessary documentation related to each of the deaths. Once that has occurred, then we are in a position to say that yes, this is a COVID death or no. We would have, I think a week or so ago, maybe more now, you would have noticed that that number would have decreased, in part because that ongoing process continues to move. it would be good if, immediately we would be in a position to say yes or no, but some cases require a more in-depth review, and we give the team the opportunity to do that. But believe you, we are keeping that on our radar, and we are seeking to ensure that every one of those deaths are classified. As it relates to whether or not they are buried, I'm not sure if Ms. Walker is in a position to speak to that.
Good afternoon. Thank you for your question. To further clarify, as the CMO would have indicated, the particular persons on the list awaiting to be confirmed as COVID-related deaths are not necessarily the same persons week after week. And so as persons are moved off of that list and the death certificates are able to be processed with a definitive diagnosis of death, then that leads us to the next steps of releasing of bodies for funerals. And so it is a process.
Thank you, Ms. Walker. Leandra Roll, The Tribune.
Hi, good afternoon. I know it was mentioned that officials have seen an increase or an uptick in cases in Andres, and I know that you mentioned that officials are monitoring the situation, but we want to get a little bit more information on those cases. Is it clusters? Is it the data showing that there's community spread? And also, what sort of recommendations have been made by health officials to reduce further spread on that particular island?
Okay, Dr. Jillian Bartlett, our Family Island Physician Oversight. Dr. Bartlett?
Yes, good afternoon, CMO. Good afternoon, Bahamas. So we'll speak to Andros. We've been seeing an increase in cases in central Andros in particular, because Andros is north, central, and south. So our major concern right now is in the central Andros area, where as of to date, we have a total of 11 cases, 6 of which are active. And of the 6 active cases, 1 symptomatic and 5 are currently asymptomatic, and 5 have been recovered. In that area in particular, we were concerned because in January, there were 3 events that we were concerned. On the 16th, there was a funeral, and on the 23rd, there was a party, and also I may reiterate, on the 16th, apart from the funeral, there was also a party where encouraged, where we would have had large numbers of persons gathering. 14 or even 15 days outside of that, we started to see some cases. The cases are distributed across central Andros, so we do have a bit of community spread going on there. So we are working closely with our enforcement agents to ensure that the emergency orders are put into play. Persons coming on the island have the appropriate health visa and the appropriate testing to come. As we know, to come from Nassau into any of our islands, you need to have a negative real-time PCR test. So we are working with our enforcement agents to make sure that happens. Make sure that the emergency orders are put into play, and you only have the number of individuals as stated in that emergency orders. I think it's about 30 individuals. The proper face masks, social distance, hand sanitizer. So we are also enforcing the public health measures in that community to ensure that we minimize and mitigate the spread of COVID-19 in that environment. So we are also have contact traced all of our cases, and the contacts are actively being monitored. This is also, as you know, an added venture to reduce the spread of COVID-19 in that community. Thank you.
Second question, please.
Yes, so last month, I know it was revealed that 46% of the travelers did not comply with the 5th-day rapid antigen testing requirement. I just want to get an update, perhaps from Dr. Moxie, if officials have seen an improvement since then as it relates to the level of compliance for that requirement. And are officials also still confident about the antigen system in place, especially as more travelers are coming into the country? Thank you.
So Dr. Moxie is not here with us today. But what I would say about the rapid antigen testing, we have seen some improvement. I don't have the numbers exactly in front of me. We are working very closely with our tourism partners, and we are working with our data people within the Ministry of Health and other the testing sites that provide the necessary information for us to be able to monitor a little closer what is happening in that space. I'm certain that we will be in a position to provide an update report collectively with tourism on what those numbers are looking like at this time, but we have improved the requirement for testing. We have improved the numbers, the percentages associated with those that testing. Royston Jones.
Good afternoon, Dr. McMillan, and to everyone else. Going back to the recent spike we've seen on New Providence, I just wanted to ask about testing for new strains of COVID. I saw the 3 that was put up on the slide earlier, but can you speak to the number of samples maybe that have been sent off for genome sequencing to some of our regional and international partners, and whether any alternative strain since the onset of the pandemic here has been discovered in the Bahamas as yet, and how many samples have been sent off for testing?
Dr. Martin is here. She can speak to that.
Thank you for your question. So we sent off 52 samples to a lab in Brazil, which is the regional reference lab for the Pan American Health Organization, who is the sponsor for the outsourced testing. And the other question was, sorry, what was the other?
Any variants?
It was whether the variants have been confirmed.
Oh, no. Yeah, no, nothing has been confirmed as yet because that's our question. Thank you.
Thank you. And my second question is, this is something that the vaccine committee has spoken to, and Dr. Brennan has spoken to as well, in terms of proper cooling facilities for vaccine doses and sort of mapping out its distribution change when it comes in country. But if you look at Texas, for example, where officials had to scramble to administer over 5,000 vaccines on Monday after severe power outages affected their vaccine storage capacities and facilities, can maybe Dr. Brennan speak to the plan for extended power outages in the Bahamas, which we've seen more recently? And are there sufficient generators to keep vaccines viable during sort of extended outages here in country?
Okay, Dr. Brennan, he's asking for you.
Sure, thanks for the question. The Ministry of Health has an extensive plan for the distribution, deployment of the vaccine within our archipelago. So not just in New Providence or Grand Bahama, but also throughout the smaller territories and islands as well. And so in that instance, we have contingency plans in place to ensure that we pay attention to not just the ability to generate power, but backup power, and also identify partners on those islands who would be able to assist should there become a power outage issue. And so in our islands, we've partnered with some of our other agencies like Bahamas Power and Light, or we've done so with the telecommunications providers on the island, and other instances where persons have backup generation power and they may be able to assist us with the ability to ensure that our vaccine supply is not compromised and it's kept at the right storage temperatures. So we're looking, we have backup and backups to our backup situations that we are ensuring that no matter where it is, we'll be able to protect our supply and we don't end up with compromised situations. Thanks.
Thank you, Dr. Brennan. And certainly I would add to what he would have, I think, clearly communicated. Protecting our national immunization supply has been a very important consideration of the Ministry of Health for many, many years. The National Immunization Program, we have a facility where we keep the national supply. Certainly that would be utilized in New Providence as it relates to any immunizations that we are planning to roll out, including COVID. And certainly on all of our islands, we build on what we already have in place from our national immunization program, and we add, consistently to that. And Dr. Brennan, I think, clearly outlined some of what we do to ensure that we keep the vaccine safe, as well as what we will add on to ensure that the COVID-19 vaccine is safe. Karen Bain.
Good afternoon, CMO. Good afternoon, Bahamas. What advice is the Ministry of Health giving, in particularly to pregnant women, relating to the vaccine to safeguard these mothers and their unborn babies?
Okay, so I will begin. As it relates to the vaccine, the COVID-19 vaccine, we have to be guided by the studies that would have been done on the particular vaccine. And to my knowledge, to date, there is none that would have been approved for vaccination of pregnant women. So we'll have to be guided by that. The measures that pregnant women would need to continue to carry out, as long as we do not have a vaccine for pregnant women, will be those protective measures that we, the public health measures that we continue to advocate for in all groupings. Beyond that, Dr. Brennan, I'm not sure if you or Dr. Forbes would wish to add any addition. Dr. Brennan, Dr. Forbes?
Sure. So I saw Dr. Forbes was coming in as well.
I'll defer to you if you want to answer it.
No, I think there have been, just when you look at the recommendations out there, the CMO rightly stated that the studies that have been done so far have not intentionally gone about testing the vaccine in pregnant persons. And so it is the way the science is stacked up right now, that is still the recommendation, that if persons are known to be pregnant, that it is not the suggestion for those persons or are attempting to become pregnant within the time period before they would complete their entire vaccination series, that they should be vaccinated. However, if you read some of the literature and some of the recommendations that are out there, there was also a balancing act against risk of disease and risk of severe disease as well. And so it is still a conversation and still ongoing, because if the risk of the pregnant woman is higher, especially if they were to get the disease and all of the complications that could go along with it, then you do have to consider what the risk versus benefit of getting the vaccine in that situation is. And so it is a very detailed and very considered approach if someone was pregnant and volunteered to get the vaccine. But right now, it would not be our standard approach from the Ministry of Health's planning perspective to administer the vaccine to a woman who is either known to be pregnant or plans on getting pregnant within the time period of her vaccination.
Thank you, Dr. Brennan. This is a second question, please, Ms. Bain, Mrs. Bain.
Thank you, CMO, and thank you, Dr. Brennan. My second question is for Dr. Nakia Forbes. Dr. Forbes, the AstraZeneca website published updated data from their trials that indicate a single dose was 76% effective, while those that received a second dose had a reduction in effectiveness to 54.9%, while other persons that delayed the second dose to 3 months had an improved efficacy of 82.4%. This would mean that it's best to give as many persons a single dose than wait 3 months for the second dose. Has this new data been taken into consideration by the Ministry of Health for planning of the vaccine distribution here in the Bahamas? And is there any reason for concern in regarding the second dosage coming in a timely manner?
Thank you very much. That's a very good question. So when you go back to the Oxford AstraZeneca trial, this trial rolled out across various countries, and there was some variability in the way that those doses were administered. And some persons, mainly in Brazil, got one dose. I'm sorry, in the UK got one dose, and in Brazil there were two doses, and the efficacy was a little bit different, and that is being looked at. At this time, the current recommendation still is the AstraZeneca vaccine, the two doses, and that should be in the time frame that was allotted. And I think that was about roughly 28 days apart. So researchers are looking at that variability and trying to determine why that was, because there could be some sampling errors and things that were a little different. For example, age, the distribution of infections in country. And so we have to take that into consideration. And the best scientific standard is to do like an apples and apples comparison. And furthermore, when they looked at the actual antibody responses, in simple language, after the two doses were gotten rather than one dose, what was the level of antibody in persons' bodies? There was more after two doses. And so the recommendation still is two doses of the AstraZeneca vaccine at this time.
Rachel Knowles.
Good afternoon. My first question is just probably for you, Dr. McMillan. So we've seen, I think, roughly 500 new COVID cases confirmed since the beginning of January, but I believe over 1,000 cases are still active. So I know we're more than 6 weeks into this year. Does this mean that we're seeing a lot of people who are sick with COVID for long periods of time?
Not necessarily. We have a metric that we use to recover cases. We use that metric, but we may not be as, I guess, as aggressive in doing that, but we do, I believe it's a mix of both. We have persons that have been ill for a while, but we also have the issue of being, as aggressive as we need to be in order to have those numbers recovered, those numbers of persons recovered, as you see them on the dashboard. So I think what we are seeing is a combination of both things. Dr. Brennan, I'm not sure if Dr. Greenslade, who is the surveillance lead on this, I'm not sure if you wish to add to what I just said about what is happening with the recovery numbers from the surveillance unit perspective.
Sure. Thanks, Dr. McMillan. The recovery process, while we know the timing is one part of the process, we want to make sure that we are as thorough in our approach to making sure that individuals are actually recovered when we move them away from active cases into recovered category. And so what we try to do as much as possible is actually get in contact with every single one of those individuals as we try to move them into recovery, so that we can ensure that they are not hospitalized, they do not any longer have any symptoms and the like, so that we can ensure they're not someone who maybe is having symptoms for much longer than necessary, they're immunocompromised, or there's some other issue going on. So a lot of times it is not necessarily the issue of just having, the numbers matching easily. It is the human resource activity of actually contacting each one of those individuals, making sure that we can be very scientific in our approach to moving them from active to recovered, and we then don't have to backtrack and move individuals from a recovered status back into an active status as we do so. So we want it to be as clean a process as possible, as opposed to a back and forth process. Thanks.
Thank you. Next question.
Okay, thank you. I know that this was asked, I believe, in the press conference last month, but I don't think we ever got an answer. With the antigen testing, I know that if someone tests positive, they're supposed to take a PCR test to confirm, but how many people who have tested positive by way of antigen test have taken a PCR test, if you all have the numbers on that. And also, I guess, how do you all ensure that like all these different locations that are doing antigen testing, that they are reporting the positive results to you on a day-to-day basis so that this follow-up testing can be done?
Okay, so I think both of your questions are linked. Definitely our national protocol speaks to exactly what you suggested should happen, that persons who are symptomatic and test positive with the rapid antigen test, they are to be referred on for a real-time PCR test. We are aware of a number of testing sites that do exactly that. Certainly the sites that are linked to the tourism, the Bahamas Health Visa, many of, or if not most of those sites do exactly that. Would I say to you that we are getting the reports from all sites that are doing rapid antigen test? No, I will not say that. We continue to reach out to sites that we know are testing, requiring that they, make that information available to the disease surveillance unit in a timely manner for us to be able to monitor what is happening with the rapid antigen test and those that are being referred on for real-time PCR. This is a work in progress. We are enhancing our IT platform, our systems, to be able to make it easier for that to occur. But currently, we are receiving definitely those real-time PCR positives from persons who may have had a rapid antigen test and symptomatic from a good portion of those sites that are testing. But we continuously seek to, get to 100%, and that is a work in progress. Tyler Simonet.
Good afternoon, health officials, and to all who are listening. My first question is, would health officials at any time soon be recommending that the nightly curfew be extended on all islands? Is that up for discussion for any islands at this point, other than Grand Bahama, who had their curfew extended already?
Very good question. Certainly, the graphs that were shown suggest that, we may be in a position to begin to consider it. But we will continue to monitor what is happening on those islands and make recommendations to the competent authority along the lines of what we should, what could be considered. I will not suggest that, this will happen, that those curfews will be released as of tomorrow, but we continue to monitor them, and the graphs, as was shown, suggest that we may be in a position to do that going forward. Second question.
Okay, thank you so much for that response. My second question is, some weeks ago, Minister Wells said that the workplace was now the hotspot for contracting COVID. Is that still the case as of now, or is there a new place considered a hotspot?
Okay, workplaces continue to be a place that we have to ensure that we incorporate those measures that, assist with decreasing the likelihood of introduction into the workplace and spread. Many workplaces would have done that. Many workplaces are continuing to move in the direction of doing that as they expand the persons who are coming in. As a hotspot, I think we would have shown you in the presentation that we are having clusters, and one was associated with a workplace. So the fact that, we are opening up, we are relaxing some restrictions means that this can happen. But we continue to, certainly from the Ministry of Health and in collaboration with the Department of Environmental Health, we assist with, the application of the workplace assessment tool to give workplaces a clearer understanding of where they are and what needs to happen. to move to the point of, minimizing as far as possible the likelihood of the introduction and spread of COVID-19 among staff and even patrons. So I think that is as much as I would be able to say with respect to workplaces being a hotspot. Shamarko Lightbourne.
Good afternoon, Dr. Mark Millen. So Marco Lightbourne from the Blaze 98.3 FM. With respect to the major variants outlined in the presentation, can you indicate if the manufacturers of AstraZeneca have the capability of tailoring or updating vaccines to combat these new variants, especially seeing that the country will receive these vaccines over time? Is there an agreement in place to have these vaccines modified at any point during the timeline of when we can expect to get our complete quota?
Okay, I think the simple answer as it relates to whether or not, the vaccine will incorporate, other variants as we move forward, I would think it will happen. But when you think about, the process for manufacturing, the initial vaccines that are coming on stream are not likely to incorporate, variants of the strain. So along the course of, receipt of vaccinations, depending on how long it takes, and maybe into, years down the road, if COVID-19 continues to be with us, the incorporation of the variants will occur as it does with the H1N1 vaccine. I mean, the flu vaccine currently, they look at the strain that's circulating, the most commonly circulating strain to give guidance to what the vaccine will be going forward. But in the immediate, having those new strains that are just coming on stream incorporated into the vaccine it is unlikely given the process for vaccine development. Second question?
Thank you, Dr. McMillan. My colleagues have thoroughly exhausted my other options. Thank you.
Okay. So then that brings us to the end of this COVID-19 update for the Ministry of Health, and we look forward to you joining us at our next update. Thank you, Bahamas, and good afternoon.